we're talking about tonsils and adenoids. I get a lot of questions from parents like, I just found out that my kids' tonsils or adenoids are enlarged, and either the ENT says like, here's some Flonase, come back in a month, or they suggest removing them. There's a whole lot of information that is not being told to parents, and I don't really know, like, you can't really blame anybody. It's just like, there's all of these more holistic options, and ENTs are typically not holistic or functional. So I'm going to give you some tips that you can start doing, and then I'm going to give you some other options by the end of this video, so stay tuned. One thing you can start doing right now is figuring out why the tonsils or adenoids are enlarged. And I'll tell you something, it is not because of mouth breathing. That is a common misconception. And this is exactly why I'm here, because there's a lot of misinformation online, and it's like, you just have to weed out these people and like, just go with your gut. But I'm going to tell you that there's a reason why the tonsils and adenoids are enlarged. There's a whole list of things. So like allergies, whether they're seasonal or maybe some food allergies that have gone like, but just not like easily identified. Food sensitivities is a huge one. Okay, so maybe it's dairy or gluten. You can start out by getting a food sensitivity test. There's a lot of them out there, and figuring out like, what is your kid sensitive to, because that's going to create some chronic inflammation in the nose. And if they can't breathe through their nose, they're going to choose mouth breathing every time, especially those kids that are just like this all the time. They cannot breathe through their nose comfortably. So they're going to choose mouth breathing no matter how many times that you tell them to close their mouth. They're going to choose mouth breathing every time, especially when they're sleeping. And that's a whole nother piece of like, oh, have you tried tooth pillow or myo brace? That can be dangerous if they cannot breathe through their nose, and that's not commonly discussed either. So other things, it could be reflux. Reflux can be silent. So it's not like the reflux or like belching frequently. Maybe you have that feeling of like burning in the chest, not you yourself, your child. And you need to figure that out, because if the reflux is happening, that's going to irritate the adenoid tissue or like the tonsils, and they're just going to flare up. All right. Other things that you can do is more naturopath and homeopath options. And this is where I tell parents, like, I'm not the expert in telling you what sort of supplements that you should give your child. So I always recommend seeking naturopath to address that. It's just going to take more time. So if you weigh the risk versus the benefit of, like, if your child has moderate or severe sleep apnea, like, you probably should treat it pretty quickly. And you know, if your kid can't breathe very well because of the sleep apnea, like, maybe surgery is more of like higher on the list. But something I want you to understand is that you're not a failure if you have to choose surgery. And there are many parents that try expansion, or they try the naturopath options for 6 months to a year, and they still don't get the resolution. The tissues actually get bigger. So if you are looking for, I gave you a lot of information here. If you are looking for a more comprehensive course, I have a course that I'm going to share the link in this video, and it is going to give you all the tools that you need to make a more well-informed decision, so that if you feel better about exhausting all your options before you do surgery, or maybe you get the resolution that you're looking for. That's exactly it. So check it out, and I'm going to do more of these videos.